Welcome. This is Dr. Carla Bloom at the College of Coastal Georgia. I am doing some interviewing with some of my famed friends of the world, and this is Dr. Ana Coelho. And I hope Psychology Club can use this short interview to email Dr. Coelho. She, I'm sure, would be happy to respond to you, give you more information. But a few questions for you to think about. Dr. Coelho is in Porto, Portugal, and she is someone I met many, many years ago when I visited there. And we just became really instant friends. And I'm so I cherish our professional and personal relationship very much, Anna. Obrigado,
Thank you.
obrigada. Yes. All right, question number one. I would like to know how you chose the field of hypnotherapy to get training. What led you down that path, Anna?
First of all, I think that what drew me into this field of knowledge was searching other complementary ways of understanding human behavior and better understand the mental ways of working, other ways, unconscious ways, perhaps. I think that's what drove me into searching more and becoming an hypnotherapist. I'm sorry.
That's perfect. Thank you. So you're making me think of this next question. Working with the unconscious and with hypnotherapy, some people in the United States, I think, would be nervous to visit a hypnotherapist because they think they're going to get caught in a state of unconsciousness or that they can't awaken. Can you talk a little bit about that?
That doesn't happen in the way that people can perceive. So I always want people to have both conscience aware. So like they communicate between them. Is in a certain way, I try to put your conscience talking with your unconsciousness. So just listen, because there's so much of unconsciousness happening in you, and you don't even realize you are always conscious. So you don't just disappear. You just start to talking both of the sides, like something like that. I don't know. Did I make myself clear?
I love it. One of my favorite quotes from Freud is, "Where the id is, there shall the ego be," which is exactly that type of conversation you're talking about, and really is the basis of course, psychoanalysis. But I think hypnotherapy is sort of the modern sort of use of that concept of the id and the ego in conversation.
I prefer having my patients or my clients always be in a state of awareness.
Yes.
Because that's very important, that he listens also.
Yes.
What is listening from the other side.
Yes.
So it's like three persons in the same room. So it's very, I don't like when people just black out for like minutes, because you need to intensify that connection. That's my purpose on therapy.
All right, I love that. Let me ask you about your role as a hypnotherapist. Do you work in isolation, in an office? Do you work as a team? How does Portugal as a country integrate or not integrate hypnotherapists?
We understand hypnotherapy as a discipline that needs also support from psychology, from psychiatry, from neurology. So always, especially in this century, we now realize that we don't live alone. We don't have one size fits all. That's not a role anymore. That's not a model to use. Nowadays, we need to understand that we need lots of inputs and outputs from other science. And in the place where I work, we have a psychiatrist, we have a neurologist, and once a week we discuss the cases in order to see if everyone is getting the right spot with each client. That's it.
That's
Yeah?
wonderful.
No.
That is it. And because these are mini interviews, I'm going to stop
Yeah.
now. But the purpose is for students who watch this to reach out to you and to ask more questions
Yes.
and to consider hypnotherapy in the United States as an option for them as they get ready to graduate from the College of Coastal Georgia.
Yeah.
Dr. Coelho, obrigada, obrigada.
Obrigada. Thank you so
Bom
much for
dia.
having me.
You're
It's my
welcome.
pleasure. And feel free to mail me anytime.
I will give them your information. And have a great rest of your day. It is afternoon there and it's morning time here. So I'm going to roll right into teaching right now. And thank you again. And
bye.
Bye-bye.
I hope you
Thank
have a most beautiful and joyful day.
Thank
Enjoy
you so
every day.
much. Thank
Okay?
you so much. Thank you so much. Bye-bye.
Love. Thank you. Bye.